So good evening, everyone. This is Dr. Lattimore. This is our monthly local development council meeting. And I always have to look at the calendar because it's going so quick. Today is the 19th of March, 2025. So I would like to call the meeting to order. Um, First on our agenda is the welcome remarks from Ms. Barbara Holt Streeter. Alana, is she here today?
I believe she plans on attending, but since she's
Okay.
not on yet, I would just
Okay.
actually, here she is. She's coming on now.
Okay. And the time for the start of the meeting is 7:07. Ms. Streeter?
Hello, sorry about that. I was in another meeting. My apologies.
Okay. How are you?
I'm doing good. How are you?
Good. So you're up.
Oh, okay. All right. Well, good evening, everyone. Thank you all for joining tonight's local development council meeting. It's always a pleasure to see your faces or your names on this screen. So thank you so very much. And again, as always, we thank Dr. Lattimore for her leadership, her patience, her understanding, her wisdom, her direction, along with our co-chair, Delegate Turner, as well. So welcome again. I do hope you all had an opportunity to enjoy this beautiful day as well.
So do you have any announcements, Ms. Holt Streeter, from Strategic Partnership that you like to share?
Sure, a couple of things as I'm looking down at my notes, so I do apologize. A few days ago, we hosted, along with Employee Prince George's and the state of Maryland, a federal job fair with over 2,000 people that had registered, about 100 partners and organizations. So it was a great opportunity to see so many people, but it also was kind of discerning to see so many people from that standpoint that are really in need. There are about 30,000, um, I would say, residents that represent federal employees as well as military here in Prince George's County. And so we do know there is a need to make sure we provide information and services. And so we do have various resources online, and I will make sure that either Alana or Letitia send that information out in the minutes. So those resources, so therefore that it can be placed on the website, resources for federal workers, resources for our immigrant communities as well, resources that will continue to help for all of our families that are going through some challenges and those who are not. We want to make sure there are various resources that are available also. As many of you all may or may not know, we were able to release the county executive was able to release the budget last week and then pass that on to the county council. As she said in her press release, it is a difficult $5.7 billion budget proposal. And this is probably one of the most difficult budgets that have been presented. As always, we provide about 60% of the budget, give or take, to education. And that is going to be able to continue that as well in the proposed budget. It is indicated as well that there is no focus on layoffs or anything of that nature, but we do want the residents to understand this budget is going to affect everyone in some form or fashion, but this is across the country, across the world, from the federal, state, and local levels. And if you all are looking at what's happening in the news, which is kind of hard that we cannot overlook it, what is happening, it is affecting all of us from every aspect. But we are doing our best in the Office of the County Executive to ensure that those programs and services will continue to help the residents of Prince George's County as well. So I won't take up too much more of your time, but thank you so much, Dr. Lattimore, for this opportunity.
Are you welcome? And the hiring fair you guys had was amazing. Because I know where I work, a lot of people lost their jobs and they have no desire to come back to the federal government. So a lot of them pretty much went to the school system, which I was happy to hear.
Yes,
Because we need so many people in the school system for our kids.
yes.
It's a big decrease in pay for a lot of them, but everybody's got to eat. They got to provide for their family. So kudos to the county for the hiring fair. A lot of them that I know in my office, they picked up a lot of information, and I think 3 of them were hired. So
Oh, that's
yeah,
great.
so that was real good. It was very well publicized, and that's the one with Glenn Ivy, or
No,
is that
that
a
was
different
different.
one?
Yeah, this was with the state of Maryland, the governor's office,
Yeah,
Lieutenant Governor was there,
more.
employed
Okay.
Prince George's. Yeah, so
Yeah.
but Congressman Glenn Ivy has been doing an amazing job of providing those virtual town halls as well. So it's really all hands on deck from the federal, state, and now local elected officials all doing their best to make sure we provide those services and resources.
Yeah, well, that was great. I was glad to see that, and glad to see that people got jobs. That was
Yes,
the
that's
most
very good to
important
hear.
thing. So
Very
great
much so.
job.
Thank you.
Okay, so has everyone read the minutes? I know Alana and Letitia always send them out. So if you've had an opportunity to read the minutes, um, I appreciate it. And does anybody have any objections to the minutes? If not, I will go ahead on and make a motion that we accept the minutes as is, and we will move to the next item on the agenda. Does anybody have any objections to the minutes that were sent out for well, month before last? We didn't make quorum last month, so we didn't have a meeting. So that would be for January, would it? Yes, for January's meeting. Okay, seeing no objections, I, Dr. Lattimore, hereby move that the minutes for the Local Development Council, January 2025 meeting minutes be accepted as is.
Second.
Okay, there's been a second. All those in favor say aye.
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 Aye. All those opposed? Thank you. The motion has been carried, and the minutes for the LDC meeting for January 2025 are hereby approved. Okay, so the next thing on the agenda is they have county executive updates, but Ms. Holt Street already gave those, unless you have something else.
I'm sorry. I do have one other thing. It's our
Okay.
summer youth enrichment program, which is for ages 14 through 24. That registration ends on March the 31st. So that will be another link that I will ensure Alana and Letitia has, so they can provide that information to LDC as well as to the members of the community as well.
Oh, okay, that's great. Thank you.
You're welcome.
All right, so we're gonna go move on to our elected officials. So Delegate Woods, we will go with you first.
All right. Good evening again, everyone. I'm so glad to have the opportunity to see or hear from you. I am extremely excited about the work that is going on in Annapolis. This has been a very trying time, as I'm sure you all know, for us in Annapolis, as we're dealing with the horrendous budget challenges and dealing with trying to make sure that we're available to our constituents in light of the massive executive orders that have impacted a lot of Maryland residents. I personally have been working on some legislation. 3 pieces that I'm happy to share with you have passed both the House and the Senate at this point. The first bill is HB 666. We're not going to hold on to the 666 because we know we're blessed. Amen. So we're not pressed. HB 666 is called the Maryland Medical Assistance Program and Health Insurance Required Coverage for Calcium Score Testing. I put this bill in when a young lady whose organization I'm a part of, Dr. Florence Champagne, Open My Heart Foundation, came to me to say, in light of the fact that Maryland has the highest rate of death in the state of Maryland is cardiovascular disease. And so I put in a bill at her request that also became a Legislative Black Caucus of Maryland priority legislation. You all know the Legislative Black Caucus of Maryland is the largest Black caucus in the United States. What this bill does is require insurance companies to cover a health test, which we call a calcium score test, which helps to alert people of their risk for heart disease. The thing that makes the calcium score test so significant is that this test can be done on people who are completely asymptomatic. In other words, have no signs of heart disease, but may have other physical barriers, including diabetes, high blood pressure, high cholesterol, and or a family history of heart disease. If they have any of these and or their primary care physician makes the recommendation, this law now says that insurance companies have to pay to have this testing. Unfortunately, a lot of companies were not allowing to have this testing done and be covered by their insurance. What makes this significant is that having that calcium score test reduces the chances of serious health issues because you catch the risk ahead of time. It actually lowers healthcare costs because once we realize we have all of those challenges, guess what? The cost of getting the treatment far outweighs the cost of having the test done in the first place, right? Again, that test can actually detect if a person is fully asymptomatic and shows no immediate signs of having heart disease, which makes it such a significant test. It also ensures that more people, especially people of color and folk in underserved communities, can access preventive heart care. So we don't have to be reactive, we can be preventive. We tried to get this bill passed last year unsuccessfully. I am so excited that we got it passed, y'all, in the House and the Senate. It did have a Senate crossfile. Senator Malcolm Augustine, and again, was a legislative priority for the Legislative Black Caucus of Maryland. Second bill that I was able to get passed, y'all, through the House and the Senate is called, it's HB 970, Health Insurance, Insulin, Prohibition on Step Therapy or Fail First Protocol Status. How many of you have had your doctor to say that you need a medication and then your insurance company wants you to take a genetic brand or a cheaper brand that a lot of times is less effective. And what the insurance companies want you to do is fail at a medication first. Well, how many of you know when you fail at a medication, it can cause you to have other problems? When you have delays in getting the proper legislation, some people have not actually even lived to get the proper medication or the proper treatment because the insurance company wants to keep trying these cheap, ineffective medications first. And this bill says that you cannot do that. If the doctor prescribes a certain medication, you do not have to wait to a person to fail from that medication, causing serious complications like strokes, heart attack, kidney failure, because they're taking a medication that's not effective. This is for people who have diabetes and are prescribed an insulin that the doctor knows is the insulin that they need for their treatment. So this lowers long-term healthcare costs by preventing emergency care and hospital stays, which are a lot of the things that happen when people have to fail at a medication first. We've passed that in the House and the Senate too, y'all. God is good, and I'm excited about it. I can
Make
say
sure
that.
you send it to CBS.
So this is exciting. The last bill that I have has passed the House and the Senate so far is the Behavioral Health Advisory Council and Commission on Behavioral Health Care Treatment and Access. This is a plan to implement early and periodic screening, diagnostic, and treatment requirements. This also passed the House and the Senate, y'all. We're doing well. This creates a work group of health experts to improve healthcare access for our children. It focuses on the necessity for early checkups and treatment, particularly for those children who are displaying behavioral and mental health challenges. It ensures that all children, especially those in underserved areas, get the care that they need. It helps the doctors and health providers follow the best practices to improve the children's health and child health services, prevents long-term health issues by identifying problems early. I'm so tired of us being a people, a state, and a nation that is always reactive and not doing preventative things. You know, a lot of times our kids get in trouble and we don't go back to the root cause. We deal with the issues, and a lot of times we deal with them punitively and don't even realize some of the root causes have to do with mental health, right? Some of the root causes of behavior have to do with physical ailments that have never been diagnosed. And so this study requires a full report by June 30th, 2026, with recommendations to improve health care for all kids. Those are the bills that I have that have passed the House and the Senate and that we believe are going to pass and go into law. I have two other bills. One of them, both of those bills are wound up in rules. And what it means when a bill winds up in rules is means it was not filed in enough time to follow the appropriate process. In my case, the reason my two bills wound up in rules is because I didn't find out about the situations until after the fact. I always tell people, call me early, call me during the interim so that I can work on your legislation for you. But when people bring me legislation that I feel like this is something we need to do, I will go ahead and submit it. And so these two pieces of legislation, one of them a young man by the name of Amari Barnes, who lives in our district in District 26, was raised by his grandmother since he was 2 years old. And boy is an excellent student. He's at Croston High School. He just got appointed to the as the student member of the Board of Education. He actually, along with another youth, started a law youth camp. Him and another student to help kids who want to go to law school. Okay, he's just in the 11th grade, y'all. And he wasn't able to get his ID because he lives with his grandmother, and his grandmother is not his legal custodian or legal guardian. And yet, from the time he was 2 years old, she has provided primary care for him. She's enrolled him in school. She's taken him on all of his doctor's appointment. But when it came time to get an ID, they said she couldn't help him get it, and he can't get it as a minor. And it's his paternal grandmother. So his father is the person that, that's his father's mother. And his father basically has been in and out of the home. But when we tried to get his father to help him get his ID, because the father's name is not on the child's birth certificate, we also couldn't get it. Then they told the father, well, go get your birth certificate. He couldn't find his own birth certificate. And then he just got discouraged. And so I had no idea this is a problem that young people have. And so I've had meetings with people, and we're going to try to get that out of rules and actually get it passed as emergency legislation, because after I started investigating, I found out, y'all, this is a problem in Maryland. It's a problem in the District of Columbia. I did not know that you have young people trying to get driver's permits, trying to go to college, trying to do work programs that can't do it because they don't have a valid ID, because they don't have a legal guardian or legal custodian. So my bill says, if you can provide proof that you have been the sole caretaker for this child, i.e. the doctor sends a note that says, yes, this is who I see. The school sends a note that says, yes, this is the only person we dealt with. That person can be the alternative identifier person to help this child get all of the things that they need. And so that's another bill that I'm trying to get out of rules. Another bill that actually came out of rules is a social work bill. This is a controversial bill and still controversial. I am a licensed social worker. This bill I'm requesting that we do that says that people don't have to pass a licensure exam to become a social worker. Why would I put a bill out like that? Because what we found is that the passing of the licensure has had no impact on the quality of work of social workers. And we have a social work shortage. There were several assessments done, independent assessments done, that show that the social work licensure bill is racially disparate, that it is culturally biased. They have proven this over and over and over again. So a much higher percentage of non-people of color pass the exam than people of color. And yet people of color have demonstrated their ability to practice in the same capacity as those persons who have licenses. And so my thing is, we want to look for an alternate, especially now when we have a shortage. Do you know in the state of Maryland, we have a shortage of over 20,000 needed social workers in the state of Maryland? And who's impacted the most? People of color, people with disabilities, people who have low income. And so I am trying to find an alternate path, because the research is out there that shows that the licensure itself, these people still go to school, they get 4-year degrees, they get master's degrees, and then they tell you can't practice because you can't pass an exam, but they're practicing under supervision, proving they can do the work. And then people are saying, but you can't get licensed. And yes, I'm happy to talk to anybody about it. Thank you, Ms. Vincent. So please, 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 I'm not going to hold you up much longer. I know I've taken up probably more time than you wanted. But thank you for this opportunity.
Okay, well, thank you for all the hard work you're doing, and we appreciate the work and helping the youth and things like that. I think Letitia, you had your hand up first.
I didn't raise my hand. I just put a comment in the chat just saying to Ms. Delegate Woods to talk offline. I'm working with a coalition that is working on reciprocity and helping look at how social workers are giving their credentials. And there's a shortage, across the nation for mental health providers, particularly in schools. And so there's a lot of other coalitions that are working on that with data and evidence and support that may, you know, support what Ms. Woods is doing. And so I just wanted to raise.
Okay, thank you. Ebony, did you have your hand raised?
No, I was just giving a heart to it because I'm one of
Okay,
those social workers.
okay. Tequila, how are you? I see your hand is raised and it's your turn to give your report. Oh, that's my mouse. So I'm just going to call on you. Tequila, are you ready to give your report for Senator Muse?
Yes, hi, good evening,
Good
everyone.
evening. It's good to see you.
Yeah, it's good to see you too. I feel like it's been a long time. I don't think
It has.
since like last year.
Yeah.
Yes, well, happy to be here. Hopefully everyone is having a wonderful day. It was beautiful out today. Hopefully you got a chance to get out there and enjoy some sunshine at some point during the day. I just wanted to go over just a couple of things. Senator Muse, of course, has been, you know, like everyone, like the whole District 26 team has been hard at work for everyone this session. Senator Muse actually sponsored 27 bills this year. That's actually over the limit that we're allowed. So he's truly been working overtime for the community. And of course, his primary focus is always on broadening opportunities for as many residents as possible. I just wanted to share maybe three of his legislation that he has put forth this session. The first one that we're really excited about is SB 587. That is the State Government Maryland Reparations Commission. This bill establishes a Maryland Reparations Commission to study and make recommendations relating to appropriate benefits to be made to individuals whose ancestors were enslaved in the state of Maryland or were impacted by certain inequitable government policies. So we're really excited about that. It did pass on the Senate side so far. So fingers crossed it's crossed over to the House side. And we're hoping that that bill will pass through the session this year. He also put in two bills regarding safety on 210. And though both of those bills were actually a direct result of the advocacy of the community members, specifically the Maryland 210 Safety Committee. And so I just wanted to give them a shout out. But Senator Muse put in legislation for a highway memorial on Maryland 210. And that bill basically was asking for a memorial sign to be posted honoring those who have tragically lost their lives on Maryland Route 210. It just serves as a reminder of the importance of highway safety. So that should be coming soon. And also, Senator Muse put in a bill for speed cameras on Maryland 210. We already have them, but we were trying to increase the fee structure to actually change some behavior. So that legislation increases civil penalties for reckless speeding violations caught by the monitoring systems on Maryland Route 210. And of course, the goal is always to just simply save more lives with that. And as always, you know, everyone's voice matters. And so just like Delegate Wood said, the more that we hear from everyone, you know, the needs of the community, whether it's in the interim or in the session, we please just, you know, really want everyone to share their thoughts with us with anything that is needed in the community. And also we have our annual scholarship coming up, of course. The deadline isn't till May 19th. I will post a link in the chat for anyone who knows any scholars out there who may need a scholarship. They just have to go to a school in the state of Maryland and be a resident of District 26.
Okay, well, thank you. So I just wanted to bring up one point, maybe that Senator Muse and you guys can look into.
Okay.
My backyard faces 210. So, you know,
Okay.
my backyard is fenced in and then it's a whole bunch of woods. And then on the other side of the woods, it's
Okay.
210.
Okay.
So I hear and see everything that goes on at 210, helicopters landing every time they do it. So one of the complaints from our HOA is that the flight patterns apparently have changed in and around Kirby Parkway, you know, Aragona Drive, all the way down to 210. So,
Okay.
we're used to planes and stuff flying over the homes, but now they're flying lower.
Mm-hmm.
They're
Mm-hmm.
flying longer at night.
Okay.
So I signed up for this class, the Prince George's County Police Academy, and that's
Mm-hmm.
on Monday night. So I asked them when I went to class, um, why is it all of a sudden now?
Mm-hmm.
I'm used to the ambulance helicopters. I know the color of them and stuff.
Right.
You can hear them.
Mm-hmm.
But right now it's like all the planes going to and from Reagan National
Mm-hmm.
Airport, and they stated that it was a flight. They had changed the routes for the
Yes.
planes.
Yes, that's true. Yep.
Okay, so I just wanted to double check
Mm-hmm.
because I explained this to the HOA, and they want to know who do they call, and I'm just
Mm-hmm.
like,
Mm-hmm.
if they change the routes,
Yeah.
I don't know who you call.
Right.
I'll bring it up to
Yes.
you guys to see what I can go back and tell the HOA, but
Okay.
it could be like 12 midnight, 1
Mm-hmm.
in the morning, and I mean the helicopters, you can just hear them. It's like you're in Compton or something, and it's
Right.
big shooting at night.
Right.
So, are they planning on keeping it like that because of the accident that they had there earlier this year with the plane crashing?
Right. That I'm actually not sure about. I'll have to look into whether they plan on keeping those like that. I know that they have changed. But I'd have to definitely look into it and I could get back to you on that.
Okay, just let him know that it's like my entire community, the
Mm-hmm.
condos, the single family, the town,
Yes.
everybody's complaining about it.
Okay.
So
Okay.
if I know it's a nuisance for us, and we're not the
Mhm.
only ones because
Right.
there are other homes that are affected, but that's something I think the county needs to look into because
Mhm.
one, elderly lady, she constantly calls me. She says, I think they're going to crash into my house. And, I have to convince her, no, I think they're going to fly.
Right.
You just have to listen to, the noise. So
Mhm.
that's a serious complaint.
It is.
I don't know
Absolutely.
if they can do the rerouting, but you
Okay.
also have helicopters that are flying people from hospital to hospital as well.
Right. Okay. Got it.
Okay, I appreciate that. Okay, so Delegate Turner is not here, so we're gonna move up. So an update on the grant partners. So as you guys know, everyone was given a grantee that they would partner with and check on every month and introduce themselves. So I wanted to know if anyone has contacted their assigned grant awardee and introduce them introduced yourself to them. That the main purpose of that was to build some type of partnership between the awardee and the LDC. This year, as you all know, is the last year we'll probably be giving out grants. Well, not probably, we will. The county council voted that we do not have any funding from 2025 all the way to 2027. But more importantly, it was brought up by District 8 council member that the LDC was never supposed to be given grant money from the beginning when the MGM was built, that the law does not stipulate that the LDC receive any funding to give out grants to nonprofits. So I did challenge that on several fronts. I went down there to testify. Um, and that was a situation of unprofessionalism, but I digress. So being the fact that there is no funding in the statute for the local development council, we won't be getting any more money. What I found so interesting is that the if that language was never written into the statute, then why is it this year that this issue all of a sudden came up? And so I think it's a matter of, political agendas, the budget cuts, and the fact that the county council did not appreciate the LDC giving Prince George's County Police Department any funding year before last, which, you know, everybody makes mistakes, but I just found it very hard to believe that this year, all of a sudden, everybody wants to jump on to the bandwagon of we never should have been receiving any funding from the MGM whatsoever. So I did speak to Delegate Turner and myself. We did speak to the LDC in Anne Arundel County, and the guy that would help write the bylaws for the LDC. And he said that his intent was always that we get money, but that's nor here nor there because that money was stripped away from us. So the nonprofits that we have this year will be the last nonprofits that the LDC will have authorization to monitor their money for. We won't be giving out any money this year. So I don't think it'll be anything for us to do as far as going to the workshop that Kanika gives every year, because we won't have any grants to rate or anything like that. And the Councilman Burrows did state that 3 of the LDC's members voted for that, voted that the funding be taken away from the LDC and given everything is going to fall underneath the District 8. So with that said, does anybody want to give a 2-3 minute presentation on their introduction to their grants awardee? Or has anyone had an opportunity to reach out to their awardee? No one? Okay, so if you haven't had that opportunity, let me just be clear in the meeting today. Pretty much that's probably going to be the major role that the LDC has, is to monitor the work that your grant awardee is doing in accordance with the purpose that they submitted their application for. A lot of times they'll reach out to Alana and to Letitia and say that they're having events. And when they have those events for each awardee, I'll ask them to, send it to me or Evelyn, and we will send it out to the prospective council member that is overseeing that grant. So the expectation is to just reach out to them, introduce yourself, that you sit on the council and ask them, how things are going. I will say that everybody submitted a mid-year report, and that most of them were very well written, because I think we changed some of the questions on them. So does anybody have any questions about anything I just stated, other than the grants being taken away from us? Because that's something that we don't have control over, since we never should have been awarded any funding. Did you want to say something, Barbara?
Yes, I do. I do. And so, and I don't have my information in front of me. I do apologize. But I do want everyone to understand, every year we have a budget process, as you all know what we're going through right now. And so for this budget process for this year, yes, the county council decided, although the Office of the County Executive presented their proposal, local development council, you all presented your proposal, and the county council made that decision for this year that they were not going to provide any additional funding for grants.
No, they said for 27, all the way
No,
from.
no, ma'am. So
Why is that on the budget sheet?
so it's a multi-year spending plan.
Mm-hmm.
So every year they go back and look at the budget again, so they can go back and make those adjustments, just like we have an overall budget proposal. So
Mm-hmm.
every year that budget can change up, down, or whatever the case may be. So for this particular year, yes, the budget was removed for that funding for Local Development Council. And I see, oh, Delegate Woods. Okay, thank you. Got it. And so I wanted
That's
to make sure
Letitia.
yeah, I didn't want anyone to walk away thinking that, oh my goodness, we'll never have any money again. That is incorrect. So that's just this 1 year.
But
And
I have to stop you right there, Barbara, because
sure,
Councilman Burrows testified at the hearing that the Local Development Council was never supposed to have any funding whatsoever because it's not in the Maryland statute. Delegate Turner, chief of staff, and I and her, all three of us, we looked into this. And, you know, he said it in the testimony. So I think that we need to be clear. Yeah, we can go back and look at the budget every year, but he stated that we were never supposed to be given funding to give out grants to nonprofits. It's recorded, and I listened to the recording. I was there, so.
no, I understand, Dr. Lattimore, and I was as well. So I do understand, and I did hear what he shared as well. But money is, I'm not going to say that it is guaranteed that you will receive money, that the Local Development Council, I cannot say that. I don't have the statute of the law in front of me, but I do know every year, and this was the first year in a number of years that the money was not allotted to to LDC. But again, as I mentioned, every year they review the budget, just like our budget
Okay.
review process. So next year it could look different. That 1 year was $450,000. 1 year was 850,000. So that again, they will look at it. The Office of the County Executive will present their proposal. Local Development Council will present, and then the County Council can come back and may or may not say, yes, we're going to give money for this year, or we may not give.
So then there's a disconnect, and there's a disconnect, and that's one of the things that frustrates me, because I'm all into transparency. So if you're putting out information stating that the LDC should not have funding to give out to nonprofits because it's not written in Maryland statute, but you're telling us that they look at it every year. Where's the disconnect, or what am I missing?
I don't think it is and I apologize if it is a disconnect. But again, every year they could go back and say, you know what, we're going to put this money aside. We're going to put this money aside for the grants under the LDC.
Mm-hmm.
This year, they chose not. They chose to take that money away and move that money as they move money around in a different direction. So the county council has decided to do something different with the funding. Next year, this could be a whole different conversation. When I came on board, it was $850,000 that was allocated to Local Development Council. Then it was reduced down to $450,000, I believe. And so next year review process, it could be 450, it could be 850, or it could be lower. I don't know that. None of us would know that until we go through that process again.
Okay. Well, we're going to leave it at that. And because I don't think that we're going to get anywhere on that, but I do appreciate you explaining that piece, which is the most important piece,
Yes.
that you can be looked at, every year. And I know even with what's going on in today's world, it's probably going to take us another 8 years to fix what is broken now, or what's getting ready to be broke, or broke tomorrow. I don't know. So, the budget is going to be a big thing across the country, period, in all states and counties and local governments. And I know that, we have a $3 billion deficit for Maryland. Is that what Governor Moore said? I think it was 3 billion. I read it. So that's something else I think that, everybody is struggling with in the state of Maryland.
It is. Yeah, it's across the country, unfortunately. And we just continue to serve the residents, as we will continue to do, and councils and committees and boards and commissions such as this has made a major impact on the lives of Prince Georgians as well as the nonprofit organization. So we
Was
thank
the
you all so
LDC the
much.
only people that board or council that had money taken away from them? I can't remember that budget sheet as many times as I looked at it.
No, I mean, money was redistributed across the board.
Yeah.
Yes, ma'am.
I know DeepHigh lost money too, so
Yes, ma'am.
Okay. All right then. So with that said, the mid-year reports, as I stated, you know, we've received them. They were very well done. I want to thank Alana and Letitia for helping us to compile those and put those in the correct folders on the SharePoint. So if we're ever audited, we do have documentation on file as to what these grants that we awarded to certain nonprofits we're doing and what they plan to do in the future. And I think it was a great suggestion from Letitia last year that we look at the form and see if it's any questions that we wanted to reword to get more information. And I have to give it to the awardees. All of them were more than willing to give us documentation, to show us what they've done. Some of them sent pictures. So they were proud of their own work. So they're out there doing what they're supposed to do for the county. And, you know, we appreciate that. It's nothing like transparency. All right. So is there anything else that anyone else would like to discuss tonight or would like to be on the agenda for next month?
I just wanted to raise that all recordings for the council hearings and the LDC meetings are online. Alana is looking for the link to drop it in the chat for you guys before you adjourn. But if you are interested in knowing what was said at the council hearing, you're more than welcome to go online and look at those recordings so you can hear what's his justification and what are his plans going forward.
Thank you. Okay, with that being said, I'm gonna give you guys some time back tonight, but I do want to talk to Barbara, if you could just stay behind for like, I only keep you 2 minutes. Is that okay?
Yes, I was trying to go
Okay.
on mute. Sorry.
All right, so I do appreciate everyone coming out tonight, and with that, I will move to close the meeting out. I, Dr. Lattimore, hereby close the LDC Council meeting out today, March 19th. Do I have a second?
Second.
All those in favor? Aye.
Aye.
All those opposed? Thank you so much. This meeting has been adjourned and it is 7:49 p.m. Everybody have a safe week. Thank you.
Thank you.